My name is Tiffany Christensen. I am from Durham, North Carolina. I work at Duke University Health System. I work professionally as a patient advocate in Duke Hospital, primarily in the area of oncology, but I also serve as a patient advisor for Duke Hospital in helping them to expand their patient advisory programs. I've been a patient since I was born, so healthcare is something that in a weird way I've been comfortable with and equally uncomfortable with throughout my whole life. And I think that at some point it became something I started to become fascinated by. That exchange between patient and family and provider is something that is so delicate and something that is so hard to perfect that it became an interest of mine to start to talk about the patient experience. I guess you could say one of my strengths and weaknesses is that I am very outspoken, and so it became something that I was comfortable talking about and sort of expressing what it feels like to be in the bed. And through that process, I really began to listen to what it feels like to be standing by the bed. And it was that listening that allowed me to really become engaged in this conversation of how do we do this together as a partnership? And to me, that is a fascinating question. We look at things like hourly rounding. We look at things like bedside shift report. Those are things that are standard or becoming standard tools, best practices. Those are wonderful things to operationalize person-centered care. At the same time, as a patient, I know that my greatest moments of partnership have not necessarily come because of a tool. They've come because of the individual who's standing in front of me, respects me as a human being who knows my body, who has a history with healthcare, who has a history with this illness. And now we're partnering and talking about what is realistic for me. What am I actually going to do when I leave? Am I really going to do 17 nebulizers a day? No. And so the providers where I find partnership are the ones that are willing to look at me and be honest and allow me to look back at them and be honest. And that's a rare experience to have. I think it's becoming more and more common, but as my time as a patient evolves, I can look back and say that there were many providers that I lied to, many providers who probably didn't mind that, because what they really wanted was to walk in, give me a prescription for a care plan, have me nod my head and leave. And now we're looking at what does that feel like, or how does that function when we're honest with each other, and I get to tell you, you know what, I'm not going to do those 17 nebulizers, so let's talk about what I can do, and let's make a care plan that's realistic and that both of us can feel good about. And that, to me, is something that is so personal that it's really hard, and that's why I think what we're doing is so hard, because there's the big picture, but where the rubber hits the road is those moment-to-moment interactions. And that's hard to put on a piece of paper, and that's hard to say, here's how you do it. It's really so personal. One of the greatest ways to affect change when we're talking about person and family-centered care is through story. To take the patient family advisory council and allow them the stage for which to tell their story in an effective way to the people who are going to then be motivated to implement those new programs, to change those policies. And for me personally, one of the greatest examples of that was a little talk that one of our advisors gave. It was a very short talk. It was about 15 minutes, which as a person who gives talks, you think, what can I do in 15 minutes? That seems so small and trivial. But what ended up coming out of that little 15-minute talk was a doctor sitting in that room who said, oh my gosh, I've been doing this wrong. All this time, I have not been engaging my patients and families in a way that is to the benefit of all of us. And so from that moment, from that little 15-minute talk, she decided to change the way that she did things, and she implemented pretty quickly a whole program around patient and family-centered rounding. So the way that she rounds on her patients is very different. The way that she preps her patients in the outpatient areas is very different. And now the whole continuum of care for her patients is very different because she set the stage in a completely different way. And that all came out of, and that doesn't happen with one doctor. That has to happen with the nurses and everybody else who's rounding with that physician. That is a culture change within one surgical area. And that all came out of one patient story told on one day in 15 minutes. And that is a great example to me of how what one little pebble can be such a huge ripple, and you may not even know that all of that came from one story.